I'm Dr. Race with Advanced Chiropractic, and today we're going to go through some general low back stretches. Whenever you do these stretches, you want to do them in a pain-free range of motion. So as you're doing them, if you feel pain, you want to back off a little bit. So you want to feel the stretch, but you don't want to feel pain. Another key is you want to make sure that you're actually breathing as you do these. This first stretch is where I'm going to have you come on up on your elbows here, Bo Karen. So you're laying flat on your stomach, and then you're going to push up on your elbows, and you're pushing your back into extension here, okay? And as you do this, you want to hold it for roughly 10 seconds. And then after you hold it 10 seconds, then you go back down and you relax for 3. So if you want to go back down and you would relax for 3 seconds, then you're going to go ahead and push back up for 10 seconds. And so you should feel stretch in your back here. You want to do this 3 total times. Once again, pain-free range of motion, and you want to breathe as you're doing it. If this is not getting enough stretch, then you could increase the stretch by putting your hands down and pushing yourself up a little higher, okay? Of course, you want to make sure it's still in a pain-free range of motion. If you're feeling pinching or pain, you want to back off and go lower, okay? If you have any questions about this stretch, let me know on your next appointment. The next stretch is really for your low back and then the glutes, or the posterior part of your legs here. When you do this stretch, you lay flat on your back and you're gonna cross your legs in a figure 4, and then you're gonna bring the other leg up, and you can reach through your leg here and grab this thigh, just like this, and you can pull towards yourself. Now, when you do this, pain-free range of motion, breathe as you do it. If it's too much pressure causing discomfort, you can relax the legs, right? If it's not enough, you can pull the legs up higher. Another way you can do this stretch is if you lay on the floor close to like your counter or the wall or something, you can put your foot up against the counter or the wall, and that way you wouldn't have to use your arms to pull your leg up. But once again, do this stretch, pain-free range of motion. You're gonna do it for 10 seconds, then you're gonna relax and let it rest for 3, and then you do it for 10 seconds, let it relax for 3, and you do this a total of 3 times. Then you're gonna switch legs and do it on the opposite side. 10 seconds on, 3 seconds off, a total of 3 times. Okay, this next stretch is a hip flexor stretch, and you may also feel it in the side of your low back as you do this as well. So when you do this stretch, you're gonna sit on the floor in this figure 4 position, and whenever you start the stretch, you're gonna reach down towards your toe, trying to keep this knee close to the ground as possible as you do that. That way you get the hip flexor stretch, but then also the low back stretch. When you perform this stretch, you're gonna do it for 10 seconds on, then you relax for 3, and then you do it 3 total times, okay? And then once you do the left side, then you would switch and you would do the right side. 10 seconds on, 3 seconds off, total of 3 times. You're gonna do it in a pain-free range of motion, and make sure you breathe through the exercise. Okay, this last stretch is for the lumbar spine or your low back, and it's really to help the range of motion with twisting your back. So you're gonna lay flat on your back, and then you're gonna bring one leg up and over, and you're gonna lay there letting this leg go away from you. And if you're on the floor and you need to stretch your arms out and rest them on the ground, you can certainly do that. So this is gonna stretch the lateral hamstring and then also the low back. When you do this stretch, you wanna do it in a pain-free range of motion. If it's painful, you wanna back off, not stretch quite as much. The way you can back off is let your leg go kind of down and back a little bit. If it's not quite enough stretch, you bring your leg up and let it roll a little more. You do this stretch for 10 seconds on, 3 seconds off. You do this a total of 3 times, and you do the other side as well. If you have any questions about any of these stretches, just ask your doctor on your next appointment. Thank you and have a great day.